Hi guys, welcome back to my channel. If you're new here, my name is Zani. I am a Zimbabwean YouTuber. You can also refer to me as Dr. Za. I am a dentist based in Zimbabwe. Today I decided to do one of those informative videos. I'm going to keep it nice and short and simple. So I hope you like this. What's holding you down? I ain't like others. Don't let them hold your ground. Right, so A-level results are out. Congratulations to all those who passed. I think some people already know what they want to do and some people are trying to figure out what they want to do. So right now I'm trying to address the students who studied sciences, that is maths, biology, physics and chemistry. You might be wondering, what does it take to become a dentist? So let me just tell you how I got to be a dentist. So I'm going to be telling you how I got to be a dentist, and I'll also be telling you like the updated version, what's being done now at the university. So I trained at the University of Zimbabwe, which is in Harare, and I did Bachelor of Dental Surgery. For you to eventually start there, you just need to write your application to University of Zimbabwe, and if you want to be a dentist and you're certain and you're convinced that you want to be a dentist, then definitely put your Bachelor of Dental Surgery as your first option, and then second and third option put other things that you might be interested in, because you might be sent to those programs. But generally it doesn't really happen like that. Most of the times your first choice is what's considered. It's either you're in or you're out, or they will chuck you to another degree program which was not even your choice in the first place. So what's happening now, what didn't happen then, because I just applied and I got in and then I started studying. What's happening now is when you apply and then you put on the interview list. I don't think it's a waiting list, but it's an interview list. So you then invited for an interview. So in the interview you're going to have like oral interviews, verbal interviews, where where the interviewer is just asking you general questions about yourself, your background and your interest in dentistry. So you gotta be really interested in dentistry. Okay, yeah, you gotta show that you're actually passionate about the field of dentistry. And then also another part of the interview is actually quite interesting, where they actually want to assess your manual dexterity. So manual dexterity is how good are you with your hands. So they give you a little task. I'm not sure the exact task. I can't be telling you. I don't know if I'm allowed to be telling you this. But yeah, I think it's always good to just know that they're gonna test, because they just want to know that you have like just general skill. So I already said that you wanna have maths, biology, physics, chemistry. Okay, so we know, I mean, I'm talking to Mazimba Banabanditi. So is that the Wageta MBC, can't Wageta MPC, handiti. I did MBC. I loved biology. And then some people actually asked me, is it wise to go and study the human body or like health sciences when you didn't do biology? Honey, if you pass chemistry and math and physics, you can definitely study the human body. One thing that you also need to know is when you start university, okay, you're just starting from scratch. Everybody, you just MPC, whatever, you're just starting from scratch. You're learning something totally new. So not totally, but you know what I mean, like it's like you're starting from scratch, so it doesn't really matter. The most important subjects to them is the math and the chemistry. So if you're in lower 6 and you're watching this, then you want to make sure that you're working hard towards your math and your chemistry. Make sure you get your A's in those subjects, and then yeah, you'll sail through. What else did I want to say? You know, I don't even know why I don't plan these videos, because okay, I think I know why. I feel like I'm more relaxed, I'm more interactive unlike when I write things down and then I'm just looking and I'm like, okay, what's my next point? You know, I don't want to do that. I just want to free flow, let the information free flow. The kids playing outside my window. Okay, so let's move on. So it is a 5-year program, okay? But we actually learned for 5.5 years, and I'm going to explain why. So in the first year, second year and third year, you are learning with manual medicine. You are basically learning exactly the same stuff. Okay, so you learn so in the first year you're doing physiology, anatomy. God, those were like tough times. Anatomy, biochemistry, behavioral sciences. I think one advice that I would want to give someone is you need to be serious. You need to like manage your time very well. So manage your time. When it's time to study, it's time to study. When it's time to play, okay? So first year you have two exams. I left another exam. So everybody at the university does communication skills. So we do, in the first year we do communication skills for something. They're different. How am I forgetting this? But anyway, so in the first year you're gonna write two exams, biochemistry and the communication skills, right? And then in the second year you're gonna write physiology, anatomy, your comm skills again, and your behavioral sciences. So now the thing is, you actually start learning these things from first year. So by the time you get to second year, now you're studying for things that you're learning all the way from first year into your second year. When you've passed, you sail through to clinical. So now you'll be studying at Paranyato Hospital at the College of Health Sciences. So in your third year, you're going to be studying pathology, and you also start your pharmacology. That's when you're now introduced to dentistry lectures. Third year as well, that's when you're now introduced to your medicine and surgery rotations. So now it's your clinical year, now you're going into the wards, now you're seeing patients, you take history, we call it clerking. You take history of the patient and everything, you're presenting to consultants and everything. Now for us, it's very different. For the medical people, you see, like, they're just being introduced, like, okay, this is how you do things, learn your medicine surgery. For us, it is, okay, you're learning this and guess what? You're going to be examined. So third year is another tough year for the dental students because you have to master medicine, you have to master dental surgery. So this is general medicine and general surgery. Master everything. So you want to take everything that you learn in the wards very seriously. Listen to your consultants. When you're given a patient, make sure you follow up your patient, make sure you clock that patient. When you're told you're on call, go on call. Do not skip call. Make sure you take everything seriously. Be eager to present to your consultants and be eager to just learn. That is how you learn. It can be tough. Consultants can shout at you. Consultants can make you feel dumb. Oh, it's not easy, but trust me, you gotta grow thick skin and tell yourself, you know what, this is what I want, I know what I want, and I'm gonna go for it, I'm gonna get it. So you just need to stay focused. So yeah, so that's third year for you. So when the medical people go for their attachment, because that's another thing that I forgot to mention, so you start doing attachments from first year. So in first year I was actually sent to Gokwe. Oh my god, I remember crying. I cried so much because I had never been so far away from home. It was so silly. But I cried. I was like, how can I go to Gokwe of all places? But I went to Gokwe with Susan, and yeah, we actually grew much closer because of that, and it was amazing. I really enjoyed it. So first year you actually go on attachment, you go rural attachment. Rural attachment is basically just trying to expose you to the community, because you need to understand that yes, you're going to learn how to treat these people, but you need to understand the socio-economic factors that surround these people. So I was saying in third year the medical people would have gone on attachment, and then you guys, like the dental students, then stay behind because now you're studying and preparing for your medicine and surgery exams. There's something else. And then if you sail through, then bravo for you, and then now you'll be starting your fourth year. So in your fourth year now you're doing more of pharmacology, and it's mostly pharmacology, and now you're doing more of your dentistry lectures. And towards the end of fourth year, that's when you start being introduced to your clinical rotations in dentistry as well. So you're mostly now doing mostly dentistry. You only mix with the medical students when you're coming in for your pharmacology lectures. Yeah, so fourth year is much more relaxed. People actually call it party 4 because it's a party, like it's a breeze. But you need to study. Take it seriously. Oh, this video is not gonna be just for A levels, right? Probably a 4th year or a 3rd year or a 2nd year is watching this, and if you're watching this and this is helpful, then I'm happy. So final year now, you're completely split from the medical students. You're just doing dentistry. You're doing your lectures and your clinical rotations, and these medical guys are just doing their thing. And final year is just difficult for both sides. The thing that makes it very difficult for us is that you have a set of requirements to meet. So the requirements are basically patients that you need to treat. Now get this, these patients are not going to be treated for free. Yeah, these patients are going to have to pay. So you can imagine how difficult things are in Zimbabwe, and you need to find patients who are going to have to pay for treatment. And you are also saying to them, look here, I'm a student, I want to do a filling on you, and I also want you to pay. And guess what, I'm a student, it might fail, it might not fail. Okay, I'm joking. Actually, what people don't realize is dental students actually do some of the best jobs. Oh, is that too far? Is far-fetched? Okay, dental students work under supervision. Okay, so you do something, you call your supervisor. Look, I did a cavity prep. And then they're like, okay, fine, go ahead. Look, I've done this. Okay, fine, go ahead. Look, this patient has come in, they have this problem. I think this is the diagnosis, this is my treatment plan. Supervisor comes in, says, okay, yes, go ahead. Okay, yes, go ahead. So there's no way I'm going to do something, you know, on my own and saying, let's just kia. So you find that the work done by students is actually really good at the University of Zimbabwe. So if you're not a student and you're thinking about getting your teeth cleaned, filled, whatever, then consider helping some students out there. They're actually looking for patients. So I finished uni, or I finished my exams January 2016. Results came, and 1 February I had my certificate as a doctor. So you actually earn the title doctor. Yeah, so that's about it. This is what got me to be where I am right now. I am what they call a government dental officer. You can follow other routes, which is private practice, which is absolutely amazing. I have like Susan, my friend Susan, she's in private practice and she's doing very well for herself. And yeah, quite a number of people actually are in private practice and they're doing very well for themselves. So yeah, you just do whatever comes to you, what opportunity comes to you, and what works best for you. Okay guys, thank you so much for watching this video. I hope you liked it. I hope I managed to cut it short. So apparently the video cut short before I did my outro. So I'm just gonna hold this vlog style and I'm gonna say thank you so much for watching. And if you're new here or if you haven't subscribed already, please just click that subscribe button. Let's make that circle bigger, okay? Always remember to work hard towards your dreams. The sky's not even the limit. Until next time, bye.